Hi, my name is Emily Batten, and I am a WSU RN to BSN student working with Jermaine this semester, and thank you all for watching my presentation on vision. How does this work? Does anyone remember? Oh, this looks familiar. Vision begins with, eyes that open. To have vision, you must have light, eyes, and a brain. Light rays bounce off the dog's image in this picture and come back to the woman's eyes, where light enters through the cornea. Next, light rays go through the pupil, which is really a hole in the iris. The iris then controls how much light goes into the eye. The back of the eye is very important. The lining of the inside of the eye is the retina, which contains 130 million tiny cells that send information from the optic nerve that is connected to the brainstem. The two images are slightly different. It is difficult to notice because when you look at an object, each eye sees a slightly different picture. The brain combines the images to make them into one picture. Sounds simple, right? What could go wrong? Refractive errors are the most frequent eye problems in the United States. Refractive errors include myopia, or nearsightedness. The average age of onset is 7 to 10 years of age. Hyperopia, or farsightedness, is a common vision condition in which you can see distant objects clearly, but objects nearby may be blurry. The degree of farsightedness determines your focusing ability. Astigmatism, or distorted vision at all distances, is caused by a defect in the eye or the lens, resulting in deviation from spherical curvature, which results in distorted images as light rays are prevented from meeting at a common focus. In Washington State, the RCW requires all school boards to provide vision and hearing screening for their students. Washington schools shall conduct auditory and visual screening of children in kindergarten and grades 1, 2, 3, 5, and 7, and for any child showing symptoms of possible loss in auditory or visual acuity referred to the district by parents, guardians, or school staff. And if resources permit, schools shall annually screen children at other grade levels. Personnel conducting the screening must use a Snellen test chart for screening for distance central vision acuity. Either Snellen E-chart or the standard Snellen distance acuity chart may be used as appropriate to the child's age and abilities. Any chart that has Snellen and Sloan is fine to use. This chart is a Snellen chart using Sloan style letters. Signs of eye and vision problems include frequent rubbing of eyes and blinking, short attention spans, avoiding reading and other close activities, frequent headaches, covering one eye, tilting the head to one side, holding reading materials close to the face, seeing double, and frequently losing place while reading. Recommended criteria for referral to an eye doctor includes 20/40 or poor vision, misses more than half of the letters on the 20/30 test row, or 2-line difference in visual acuity between eyes. In addition, failure of any standard color vision test, which is a new finding not followed up on by an eye doctor, needs to be referred. Even if the child passes a vision screening, they should receive a comprehensive optometric examination if they are not able to achieve their full potential, or they are minimally able to achieve but have to use excessive time and effort to do so. Vision changes can occur without your child or you noticing them. Therefore, your child should receive an eye examination at least once every 2 years, more frequently if specific problems or risk factors exist, or if recommended by the eye doctor. The earlier a vision problem is detected and treated, the more likely treatment will be successful. When needed, the doctor can prescribe treatments including eyeglasses, contact lenses, or vision therapy to correct any vision problems. I looked for current research in CINAHL and PubMed at WSU Vancouver and was unable to find current research that explained why one eye chart was preferred over the other. I looked for other online sources and found that these sites wanted me to purchase one eye chart or the other. I wanted an unbiased explanation, so I called my eye doctor at Ashbaker Vision in Vancouver, who did not receive any compensation for his time. I found that Snellen is the gold standard globally for vision testing, and that is why Washington State is requiring it to be used. If a child moves out of state or out of country, this measure of eye acuity will be readily recognized. Ensuring that everyone is using the same eye chart will ensure the most standard results. Sloan eye chart spacing differs from Snellen chart, and that is another reason why Snellen is preferred. Sloan is used more to test the recognition of letters because it is easier to read from further away, not indicating that a child can see clearly. The tumbling E is the gold standard for children who do not yet know their letters. It is much easier to differentiate an umbrella from a house than it is to tell which way an E is facing. These are not considered equivalent tests according to my eye doctor. School-aged children who do not speak English can learn the tumbling E and use this test. My eye doctor wanted to make sure that I told you all thank you on behalf of the entire Vancouver optometrist community here in Washington for all that you do to help with the health of children and in the community. I hope that this information helps you in making decisions regarding the future of eye exams in the Vancouver School District.